I got my head injury September 4th, 2019. I was riding my bike to work, and on my commute, a cab driver pulled out and hit me, and I flipped off my bicycle, did a nice somersault backwards, and managed to hit my head on the ground. I'm very embarrassed to say that I was not wearing a helmet. My helmet was in my car. So I will restate again, you should wear a helmet. It was a very exciting trip to the hospital, and there were several tests taken, and unfortunately somehow they missed that I had a concussion. It actually was discovered in physical therapy a week or two later when my physical therapist noticed that I had been complaining about all the same things. That he said, I think you have a concussion, and then he referred me to a doctor here at Rush.
The research tells us the sooner you see a concussion specialist for an individualized assessment, the sooner people recover. We want to make sure there isn't any more serious injuries, such as bleeding of the brain, swelling of the brain, that could be life-threatening. Even in a less severe injury, we want to make sure that you're getting adequate information about what to expect in recovery, what symptoms to look for worsening of symptoms, and just a general understanding of what a brain injury is.
So it was very hard for me to stay focused on any activity. It was very hard to look at a computer screen for a long time. If I didn't write something down, I wouldn't remember what had been said in a meeting. At the same time, I was training for an Ironman race, my first one, and so I couldn't train for a while at all, and that part was devastating to me. So along with struggling at work, I was also struggling personally for something that I had worked at for 7 months to be seemingly taken away from me. I went in and I saw Dr. Lita Ganad, and she was able to prescribe me to more occipital physical therapy, and I did that, and I was able to start training more, but it didn't completely alleviate my symptoms. So Dr. Lita Ganad referred me to an appointment with Dr. Pieroth to figure out why I was still having these concussion symptoms. And my first appointment was scheduled for an hour, which seemed a lot longer than an appointment normally would be.
If someone comes in to see me, what they're going to get is a thorough assessment, first of the injury. It's what we call the mechanism of injury. I need to understand actually what happened to them and understand, is there another injury, such as a neck injury, along with a concussion that hasn't been addressed? And then we talk about their initial symptoms, because the research tells us that how the brain responds initially will tell us a lot about the recovery pattern. And then we look at how those symptoms have changed over time, what has worked, what hasn't worked, and what treatment they've had, what their past medical history, their family medical history.
I was very upset, very emotional, talking about struggling with both work and being an athlete, and how it had impacted my personal life, and how I was just very worried that, something was wrong with me, and that maybe I was making it worse by continuing to, run and bike, but that I didn't want to stop because that was my stress relief from work and COVID, and so it was just a circle.
She was having a lot of symptoms of dizziness, imbalance, and what we call vestibular ocular problems that had not been fully treated. So we sent her off to vestibular therapy with an experienced clinician, and she did very well. The other problem with Betsy's care is something that we see very often, and that is the over-reliance on rest. Probably the biggest misunderstanding in concussion work is that rest is a treatment. And what the data tells us is that the first 1 to 2 days, we do want people to do what we call relative rest. Listen to your body. If you're tired, you're symptomatic, take it easy. But beyond the first couple days, the data tells us that we need to start moving people. Betsy was a triathlete. I can't even imagine doing a triathlon. But so much of her life was exercise in various ways. And she was being restricted because of this misunderstanding about rest after concussion. Just letting her know that it was okay to move, and it was okay to exercise, and it was okay to start to, eke back into her normal routine was incredibly helpful to her.
I have been in physical therapy for 4 months now, and I believe that my next appointment will be my sign-off to end physical therapy treatment, which is really exciting. The results are that I can consciously acknowledge when I am feeling a headache, and I know how to bring it back down, and I know what triggers it, so I'm able to plan runs and plan bikes, and even make accommodations at work with all of our Zoom and WebEx calls, doing some simple things like turning the video off or having a document sent to me so that I can look at that document instead of everyone moving on the screens. And so it was a lot of small life changes. I would say 95% better at this point, which is great. And I have a half Ironman planned for November if the world reopens. So fingers crossed.
I see the change in people. They come in scared, disheartened, in pain, and they leave having a plan. They leave understanding that there are things that we can do about their injury, and they leave hopeful, and they leave excited, particularly athletes.
I think the post-concussive symptoms are a mystery to a lot of people, and they're easy to shrug off, so don't wait and don't think that it's just nothing, because getting them resolved is a very positive thing.